we can go ahead and we will be moving for, we will have another celebration coming for the Hindi session, the second year of celebration within a short time. That means just some 1,065 days later, we will have a celebration, I think. Thank you all. So, good evening, good afternoon, and good morning. This is the 1453rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. GURUKIRAN from Hyderabad. No, sorry, Bangalore. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have 3 sessions every day. The first session of the day is already over by from 7:30 to 8:30, and from 8:30 to 9:30 the international session in English, and 9:30 to 10:30 we have our local language session in Malayalam. All these sessions are going in a good way, and we are uploading every video on the very next day itself. And from today onwards, we will be projecting more importance to the subject rather than the name of the person. Of course, the person will be there in the video itself, so that when a person search, for example, PCOD, then you will get the IFPH video will be coming over there, and so that the person can go and read this, what is happening with the homeopathy in IFPH also. So please subscribe and share our videos to your friends and colleagues, so that homeopathy will be reaching every home. That is the aim of International Forum for Promoting Homeopathy. Today, we have a wonderful guest, Dr. GURUKIRAN, and he has presented a lot of sessions in our forum. One of the best person who is having very, very intelligent in presenting papers. He is having a classical outlook at homeopathy. Always present the scientific sessions, and he has uploaded some of his cases in international forums also, and he got very good appreciation, and his paper were published also in international journals also. And he have graduated BHMS from Government Homeopathic Medical College Hospital, Bangalore, affiliated to Rajiv Gandhi University Health Sciences. And he is a classical homeopathy practitioner from Karnataka, and having more than 15 years of clinical practice, and he is an independent researcher also. He holds a postgraduate fellowship in SCPH, International Center for Homeopathic Medicine, United Nations, and so many things about him. He has presented papers in DD channels and various papers on skin disorders also. And today, Doctor will be discussing about potentials of SIMILIMUM. Let us proudly welcome the guest of the day, Dr. GURUKIRAN. Welcome, Doctor. Please wait, I shall make you co-host. Just a minute. Okay. Well, you are the co-host. You can go ahead.
Sir, can you hear me, sir?
Everything fine.
Is my voice audible?
Yes, yes, yes.
Fine. Sir, now the slide is visible, sir?
Yes, slide is visible.
Fine. Okay, fine. Thank you for the warm welcome. Good morning and good evening to some part of the world. And I think, if I'm not wrong, this is my 21st appearance in this IFPH platform since I started a few years back. It's all credit goes to Dr. Dinesh sir and his team and the IFPH platform, so that he had given me the wonderful opportunity to share my cases, share my knowledge, and some of the clinical tips here in the platform. So I would like to congratulate again all of you. Then, okay, let's get on to the session. Now, today's topic is the potential of SIMILIMUM. So before moving further, should always give tribute to the master, Dr. Samuel Hahnemann. Because of him, we are all here today in this platform. Yes, today's topic is the SIMILIMUM, the potential of SIMILIMUM. What does it mean? Where does he mention about the word SIMILIMUM? Each substance, that is sorin, when taken is no more a item, that is the same thing, with the crude virginal H substance, but only a SIMILIMUM. This he writes in the Theory of Chronic Diseases. In the chronic diseases, he writes, for between item, that is the same, and the SIMILIMUM, there is no intermediate for anyone that can think. Or in other words, between item and simile, only SIMILIMUM can be intermediate. Isopathic and equal is a similar thing. Isopathic is the same thing. Isopathic and equal are equivocal expressions, which if they should signify anything reliable, can only signify SIMILIMUM because they are not item. He also further writes that the item, the same, even if the prepared itch, the substance should be given to the same patient from whom it was taken, it would not remain item. It would not remain the same, as it could only be useful to him in a potentized state. So that is the difference. Since crude itch substance, which he has already in his body as an item, is without effect on him. But, this is very important line, but the dynamization or potentizing changes it and modifies it. That is where homeopathy is different and stands incredible and stand tall. Just as gold leaf after potentizing is no more crude gold leaf inert in the human body. But in every stage of dynamization, it is more and more modified and changed. This is what he writes in the chronic diseases. It's a very beautiful phrase. One should read chronic diseases. Can get a lot of inputs for the clinical practice. Yes, from I think this is the introduction part. What can be expected in today's session is, as usual, I said about the SIMILIMUM, to know about some part of SIMILIMUM and the approach towards it. How can we apply? How to know about the potential of SIMILIMUM, the cases, case studies, and the treatment part. So this, I would like to say, this would be the ideal part for the today's session. If all the things has been touched by the end of the session, it will be done. So let's move on to the case to see the potential of SIMILIMUM. I would like to present a case on intussusception. We all know that what is intussusception. This is a picture of intussusception, small intestine. This is a cross-section part of it. How does it look when it happens inside? This is the intraoperative finding of the intussusception. So what is intussusception? Intussusception is a medical condition in which one part of the intestine folds into another part of the intestine. This is a beautiful picture which depicts it. As we all know that this is a tricky and critical condition in some of the patients. Usually it happens in children. Also, it may happen in adults also. In this day, I have taken a case which has been treated from an adult. So causes for it. What is the etiology of intussusception? Uncomplicated, which is unknown. It may be secondary to viral infection. Then pathologic, Meckel's diverticulum. It may be due to intestinal polyp or hemangioma, neurofibroma, or lymphoma. These are the possible etiology for intussusception. Signs and symptoms. Usually the patient will be presented with vomiting, which may be bilious or may not be, and abdominal pain, colicky, sudden intermittent colicky. Episodes occurs in 15 to 20 minutes interval. Sudden crying spells, may draw knees up to the chest. This is the picture which is depicting it, and may be present with bloody stools in the form of current jelly stools and palpable sausage-shaped abdominal mass. You may find it in clinical examination. So these are the possible signs and symptoms of the intussusception. So treatment part. So conservative management, nasogastric drainage, NG drainage, resuscitation with IV fluid and antibiotics. They may think of this is the first line of treatment. Non-operative management, air or barium enema performed if there are no signs of peritonitis perforation. We should be very cautious and you should be very careful when we taking up these kind of cases. It may result in peritonitis or perforation. It is very, very critical condition and it is dangerous too. The patient may collapse in front of you. So you should be very careful. And operative management, reducible intussusception, irreducible intussusception, resection with the primary anastomosis. So this is the primary treatment part. So what can be done in homeopathy? Let us see now. A male aged about 29 years was presented with a colicky pain in the abdomen, which is intermittent in nature, and vomiting since 3 months. The symptoms was mild in the 3 months back. Then the acute exacerbation is since 3 days. The colicky pain was severe with vomiting. So then what can be done? The patient has shown to the local doctor and treated with some antibiotics, antiemetics and paracetamol, but no much relief. But the problem persists. It used to repeat frequently, the vomiting and the colicky pain. Then they have consulted a specialist and they have advised for a scan. And they have taken the history that this patient is suffering since 3 months. So they have advised for a scan. What does the scan report says? CT scan of the abdomen. This is the magnified version of it. There is evidence of telescoping of the short segment of ileum to adjacent ileal loops for a length of 3.5 centimeters, giving target appearance. Few of the jejunal loops in the left lumbar region appears prominent with maximum caliber of 2.7 to 2.9 centimeters. Proximal jejunal and distal ileal loops are collapsed. What does it mean? Proximal jejunal and the distal ileal loops are collapsed. Minimal ascites noted. No evidence of significant lymphadenopathy. Major abdominal vessels are normal. See this line, visualized lens, multiple ground glass density, central lobular nodules with few of them forming tree in the bud configuration, noted in the basal segments of the left lower lobe. Maybe infective etiology. Impression is ileal intussusception, splenomegaly, minimal ascites. What does it mean? The proximal jejunal and the distal ileal loops are collapsed. That means definitely there is intussusception. There is an obstruction causing inside the abdomen, and definitely patient will be having vomiting and colicky. This signifies that these are the signs. When there is a sign of proximal jejunal and distal ileal loops are collapsed, definitely you should consider it's an intussusception case. Then They have done another reports. Random blood sugar is normal. All other C-reactive protein is normal. All other things are normal. Only the total protein has raised. Globulin and AG ratio has raised 5.0. And they have done anti-HIV test, hepatitis B test. Everything is normal. Negative, non-reactive. This is the blood report. There is no raise in the ESR. ESR is just 15. Total count is 7,400. As I said, all those things. LP, albumin is 3.6, globulin 0.5, AG ratio is 5. And they have advised for stool routine. This stool routine report, color is brownish, consistency semi-solid, mucus absent, blood absent, OA not seen, cyst not seen, pus cells is 1 to 2. So this is the stool test. So next, what can be done in this case? Homeopathy can treat this case. Can we take up? Or shall we send it for the surgery? What would be the patient's point of view? What would be the patient's queries according to this case? Can anybody can chat it in chat box? If anybody want to say something, anything you want to chat, the chat box is open. Have anybody treated this kind of intussusception case before? I think will be a lot of very good doctors here in this platform. Okay, shall I move on? Fine. Accordingly, the case taking has done. Mind. How can I say these kind of things? Because the patient was with somebody, his brother, in the clinic. He said, sir, he's very non-conscientious. What does it mean? Would not like to take regular medicines, regular medications, or regular any food habits, daily routine habits. No, not at all. And moreover, when I asked them, before asking these questions, do you consume alcohol? The patient said, no, sir, I don't consume any alcohol. The brother who has with him, he said, sir, he's consuming alcohol since 10 years. Consuming alcohol since 10 years. Is a daily he should consume alcohol. So no morals in him and alcoholic. This was the statement given by his brother, own brother. And I thought, oh, he's lying in front of me. Okay, then physical generals. What I have got in this case is as absolute touchlessness. Thermally, the patient is hot. This I could gather the case taking. Perspiration, profuse on the body, was sweating a lot while answering my questions. History of alcohol and smoking, both the things were there. He said, no, sir, I don't drink alcohol. But no, his brother said, no, sir, he's consuming alcohol since 10 years. Weight, 42 kgs. When I examined him in my clinic, it was 42. Previously, he was 52 kgs. He has lost 10 kgs in 3 months' time because of this problem. So what can be done now? Yes, after case taking, the main motto of the physician is to convert it into rubrics. The modus operandi is please convert the patient's language into rubrics. The main thing is what I got is he's a liar, big liar, and has got all the problems, ailments of drunkard ailments of perspiration in general, which is profuse. The main thing, the pathological is intussusception, spleen enlarged. There is a ascites, mild ascites in the abdomen. So these are all the rubrics which I have considered. So let us see now, after repertorization, what does it show here? Liar, drunkard, ailments of perspiration in general. There is an intussusception. See, there is an ileus obstruction of bowels intussusception. There is a specific rubric in the repertory, in the complete repertory. Abdomen enlarged, spleen. Abdomen dropsy ascites. So make it a totality now. So what does the totality covers? As we all see, this is the repertory chart. So what can be done now? Yes, the prescription is opium. This is the picture of opium. Opium 200. 2 doses I have given him. In front of him, I made him to take 1 dose and I have packed 1 dose to him. Next. As I said, he's a very non-conscientious patient. I have given the medicine for 15 days. There is no message for 1 month. I think 1 month, 10 days. I was wondering what happened to this case. Then after a month, I think 15 days, the brother came back. Sir, he is doing very much better. He's doing fine. He's doing all his work. I said, what is the fate of him? How is he now? He said, sir, just 1 day after your prescription, the patient started to feel better. Just 1 day. Vomiting and the colicky pain has stopped. There was no colicky, there was no vomiting after just 1 day after prescription. Only just 1 day, the appetite has increased 10 times, according to the patient itself. The appetite and the hunger started to increase. Is it a good sign or a bad sign? After the prescription of homeopathy. It's a very good sign. The sleep was good. So this is the improvement, what we can see if the SIMILIMUM is prescribed. Then what next? Then I have advised a scan for him. I have to see what has happened. Please go for a CT scan again and let me see the report. He came back with a report a few months later, but the patient has improved very well by the next day itself after taking the medicine. Within 15 days, he's back to his work. He's doing his regular routine activities without any problems. See the report, CT scan report. What does it say? No acute abnormalities seen in the abdomen of the pelvis. What did they advise when they go to the hospital? There is no treatment for this. Please, we have to perform surgery. Please admit today itself. There is an emergency because it has been since 3 months. The vomiting is severe. The colicky pain is severe. The only part is we have to do a surgery. We have to operate it to release the intussusception. This was the statement given by the surgeons there in the specialty hospital. Because of the surgery, the operation word, the patient got panic. No, I don't go for operation. Do something other than this. So then his brother was a patient of mine. So he has brought to me. He asked me, sir, this is the condition. They're telling to admit today itself. Next day morning, they'll perform surgery. What should I do? This was the situation when he came to my clinic. Yes, this was the case presentation, what I have done. CT scan is front of you. See what does the patient say. Please listen. Anyone can understand Kannada, they can listen.
ಎಚ್ ಪಿ ಸದಾಶಿವಮೂರ್ತಿ 3 ತಿಂಗಳಿಂದ ಕಂಟಿನ್ಯೂ ಗೌರ್ಮೆಂಟ್ ಆಯ್ತಿತ್ತು. ನಾವು ಜೈಸ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋದಾಗ ಇದು ಆಗದೇ ಇಲ್ಲ. ಕಳ್ಳಲ್ಲಿ
ಅಲ್ಲಿ ಏನು ಮಾಡಿದ್ರು ಹೋಗಿ?
ಅಲ್ಲೇ ಇದು CT ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸಿದ್ರು. ಅಲ್ಲಿ ಗುಳ್ಳೆ ರೀತಿ ಕಾಣಿಸ್ಕೊಂಡಾಗ
Okay.
ಫುಲ್ ಆಪರೇಷನ್ ಮಾಡಬೇಕು, ಬದುಕದೇ ಇಲ್ಲ. ಇವತ್ತೇ ಅಡ್ಮಿಟ್ ಮಾಡ್ಬೇಕು ಅಂದರು. ಅಲ್ಲೇನೋ ಬಂದು ಹೋಮಿಯೋಪತಿ ಕ್ಲಿನಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡಿಂದ ಊಟನ ಮೊದಲೇನು ಸೇರ್ತು ಅದರ 10% ಸೇರ್ತು, ವಾಸಿನ ಆಯ್ತು.
ಇವಾಗ ನೀವು ಇಲ್ಲಿ ಔಷಧಿ ತಗೊಂಡ್ಮೇಲೆ ಎಷ್ಟು ದಿನಕ್ಕೆ ಬದಲಾವಣೆ ಕಾಣ್ತು ನಿಮಗೆ?
ಒಂದೇ ದಿನಕ್ಕೆ ಸರ್,
ಒಂದೇ ದಿನಕ್ಕೆ ಬದಲಾವಣೆ ಕಾಣ್ತು ನಿಮಗೆ?
ಒಂದೇ ದಿನಕ್ಕೆ ಆಯ್ತು.
ಅವ್ರೇನು ಹೇಳಿದ್ರು? ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗಲ್ಲ ಅಂದ್ರೆ ಅದಕ್ಕೆ
ಮೆಡಿಸಿನ್ ಇಲ್ಲ ಅಂತ ಹೇಳ್ತಿದ್ದು ಅವರು.
ಆಪರೇಷನೇ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರು.
ಮಾಡಬೇಕು ಅಂತ.
ಇಲ್ಲಿ ಬಂದ್ಮೇಲೆ ನಿಮಗೆ ಸಂತೃಪ್ತಿ ಇದೆಯಾ? ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ಮೇಲೆ, ಹೋಮಿಯೋಪತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಶುರು ಮಾಡಿದ್ಮೇಲೆ?
ಅಂದರೆ ಇದು ಜನಗಳು ಹೆಂಗೆ ತಿಳ್ಕೊಂಡಿರೋ ಒಟ್ಟು ನಂಗೆ ದೇವರು ಸರ್ ಒಟ್ಟು ಹೋಮಿಯೋಪತಿ. ಲೈಫ್ ಲಾಂಗ್ ನಾವು ನಮ್ಮ ಮಕ್ಕಳು ಮುಂದೆ ಫ್ಯೂಚರ್ನೇ ಹೋಗ್ಬಿಡೆ ನೀವು ಇಂಗ್ಲೀಷ್ ಮೆಡಿಸನ್ಗೆ.
ಸೊ ನಿಮಗೆ ಸಂತೃಪ್ತಿ ತಂದಿದೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲಿ?
ಸೂಪರ್ ಸರ್,
ಬದಲಾವಣೆ ಆಗಿದೆ ನಿಮ್ಮ ಜೀವನದಲ್ಲಿ?
ವಾಸನೆ ಆಯಿತು ಸರ್.
ಓಕೆ. ಸೊ ದ ಪೇಷಂಟ್ ಸೆಡ್ when he got to the hospital, they said it cannot be treated. The only thing is operation. Please get into the IPD itself today itself, so we can perform the surgery in the morning, in the next morning. This was the verdict given by the surgeons, and they said if you deny this, you may not live from the next day. There is a danger to your life. So please, as soon as possible, please get admitted today itself, so that we can perform the surgery tomorrow. So this was the statement given by the doctors there. After hearing this, the patient got panicked about the surgery. Then he came to the homeopathy clinic, to my clinic. Then he got treated by the OPM. Now this is the situation where the patient has improved very well. The quality of life has improved. He is doing his normal routine activities without any obstructions. This is the potential of SIMILIMUM. This is the potential where we have to take the case properly, convert the rubrics, repertorize it, give the right prescription, and the cure follows, just follows. This is one of the great example to the potential of SIMILIMUM. Okay, let's move on to the next case. This is also a very interesting case. Can anyone say something after seeing this picture? What may be this case? Anyone wants to chat? Chat box. I think I am audible. I think I'm audible there. Yes. Right. It's a case of psoriasis. Dr. Rasina Mohammed. Good. It's a case of psoriasis. Yes, this is a case 60 years, was presented with the psoriatic lesions all over the body since 35 plus years. How many? 35 plus years she is suffering. She has undergone lot of treatments with lot of doctors, with all sort of ointments and internal medications. Though her daughter is a staff nurse in a hospital, she has consulted lot of specialists there. After seeing so many doctors, the psoriatic lesions is incurable. What they say is, this is incurable. We can't cure this. If you have, and you have to continue all sorts of ointments for the lifelong. This was the statement given by a lot of doctors. So what has to be done now? The patient has to apply lots and lots of ointments daily without fail for the management of psoriasis. It's just a management. It's not curative. So the psoriatic lesions were severely itching with keratinization. The patient had undergone severe turmoil in her life due to these lesions. According to the patient could not attend any kind of functions or gathering in the family because people used to treat as untouchable. And children were not willing to come near her by seeing her skin. So this was the situation. since 30 years. This psoriatic lesions has covered from scalp to toe. I'll show the pictures. See, this is the hands. Because of some of the ointment applications, it is seeing like this. Before treatment, on the legs, see now, this is on the thigh part. See how good the lesion is. This is on the back. The right thigh. So what can be done? In this case, can homeopathy treat 35 plus years of psoriasis case? How much time can we take? Can we treat this case for 3 years, 4 years, 5 years? Let's see what does it happen. After case taking, the patient has got grief due to death of her husband. The result of grief. There are a lot of ailment from mental and emotional consequences. Very, very sympathetic the patient is. And weak inclination too. When these kind of symptoms are presenting, patient was weeping in front of me. Some of the inputs was taken from a daughter also about her nature. There are a lot of turmoil in the patient's life. There are a lot of ailments from mental and emotional consequences. So what can be done now? Yes, go to the repertory. Grief, sorrow in general, ailments from, as I said, mental and emotional consequences, sympathetic, and weak inclination too. So what is the outstanding remedy here? Is ignitia. So definitely, I would like to start the treatment with ignitia because the mind has involved. So I have prescribed 1 ml, ignitia 1 ml, 2 doses in a month. So after that, what happened was, I think that has to be said. After the prescription of ignitia, definitely the patient's psoriatic lesions got erupted. It is coming out. See, in these kind of cases, what I would like to suggest to the patient is before taking the case, when it is 10 years plus case, 15 years, 20 years plus case, definitely I would give cautions to the patients that definitely after taking the medicines, it may aggravate or it may get started to trouble you. So you have to bear for a temporary time. Then it will start to reduce. This is the very cautious message I would like to give to the patients when I start the treatment for the psoriasis case, which is very chronic. As I said, after giving ignitia, it all came out. The patient got all sorts of troubles. The skin got very much dirty, very much filthy. Look, the patient complaining started. Sir, the itching is very much. The itching was so much, it used to aggravate in the night, especially in the bed. The skin looks very dirty and filthy. And there was some thin water discharge after getting scratched. So this was the presentation after ignition. So I have waited for another month without anything. After a few months, so I repeated it again. This was the thing which came out. So I prescribed her Sorinum. Sorinum 1 ml single dose. After seeing these conditions, the skin was very, very dirty. Especially there was itching in the night, in the bed. So Sorinum 1 ml. After Sorinum, the patient got improved very well. In 1 month time, almost 50 to 60% lesions were reduced. Just one dose of Sorinum. Then, again, few months later, patients came up with only the keratinization, and the itching was so severe. Itching was so severe in the night, especially in the night. So, on the basis of that, as you see in the repertory chart, both the remedies were indicated, Sorinum and the sulfur. So, these remedies is complementary to each other. Whenever you can start with the sulfur, you can end with Sorinum, or whenever you can start with the Sorinum, you can end with the sulfur. So both the remedies are complementary. So because of the thing, the skin was very, very filthy, very dirty. On the basis of that, I have prescribed Sorinum. After a few months, I have given sulfur 201 dose. Just after given sulfur, the lesions disappeared. The lesions disappeared. I again have sulfur 200. I have repeated few more doses in 15 days time. Then after a few months, I have given only 1 dose. This is the picture, latest picture of the patient. Just after 6 months. Just after 6 months of SIMILIMUM. See the skin of the patient. By seeing this, as I said, her daughter is a staff nurse. He said, she said, sir, since in my childhood, I have not seen my mother's skin, original skin. Only I can remember she used to scratch a lot. It was so much. She was having lesions all over the body. We would barely have, I think I have not seen my mother's original skin. Now I am seeing it now. After 35 years, 40 years, now I am seeing her original skin of my mother. This was the statement given by her daughter. This is her leg. See the beauty of Herring's law. First, it has reduced from upwards. Then it is about downwards. See the thigh, right thigh. See the back. Do you remember the photograph of the back? So severe it was. See now. Left thigh. All the lesions has reduced. This had disappeared. This is a small video bit.
ನನ್ನ ಹೆಸರು ನಾಗಮ್ಮ ಕಾಮಗೆರೆ. ನನಗೆ 30 ವರ್ಷದಿಂದ ಇತ್ತು. ಇಂಗ್ಲಿಷ್ ಮೆಡಿಸಿನ್ ತಕೊಂಡು ನನಗೆ ಏನೂ ಗುಣ ಆಗಲಿಲ್ಲ.
ಏನಾಗಿತ್ತು ನಿಮಗೆ 30 ವರ್ಷ ಇದು 35 ವರ್ಷದಿಂದ?
35 ವರ್ಷದಿಂದ ಚರ್ಮನ್ ರೋಗ ಆಗಿತ್ತು. ಎಲ್ಲ ಚಕ್ಕೆ ಹಿಡಿತಿತ್ತು.
ಸೋರಿಯಾಸಿಸ್ ಅಂತ ಹೇಳಿದ್ರಾ?
ಸೋರಿಯಾಸಿಸ್ ಅಂತ ಹೇಳಿದ್ರು. ಅಷ್ಟರಲ್ಲಿ ಇದು ಬೇಗ ವಾಶ್ ಆಗಲ್ಲ, ಅವಾಗ ಬರ್ತಾ ಇರಬೇಕು ಅಂತ ಹೇಳಿದ್ರು. ನಾನು ಹೋಗಿ ತೋರಿಸ್ಕೊಂಡು ನನಗೆ ವಾಸಿ ಆಗಲಿಲ್ಲ. ಆಮೇಲೆ ಇವ್ರ ಹತ್ರ ತೆಗೆದ್ಮೇಲೆ
ಇಲ್ಲಿ ಹೋಮಿಯೋಪತಿ ಔಷಧಿ ತಗೊಂಡ್ಮೇಲೆ ಎಷ್ಟು ದಿನ ತಗೊಂಡ್ರೆ ಹೋಮಿಯೋಪತಿ ಔಷಧಿ?
ಹೋಮಿಯೋಪತಿ ಹತ್ರ 6 ತಿಂಗಳು ತುಂಬಿ 7ನೇ ತಿಂಗಳಿಗೆ ನಂಗೆ ಇಷ್ಟು ಗುಣವಾಗಿದೆ.
ಈಗ ಹೇಗಿದೆ? ಮುಂಚೆ
ಗಟ್ಟಿ ತರ ಇತ್ತು, ಇವಾಗೆಲ್ಲ ಸ್ಮೂತ್ ಆಗಿದೆ.
ಓಕೆ, ತುಂಬಾ ಕಡಿಮೆ ಆಗಿದೆ ನಿಮಗೆ?
ತುಂಬಾ ಕಡಿಮೆ ಆಗಿದೆ.
ಓಕೆ, ಈಗ ಹೋಮಿಯೋಪತಿ ಔಷಧಿ ತಗೊಳ್ಳುವಾಗ ಬೇರೆ ಏನಾದ್ರು ಹಚ್ತಾ ಇದ್ರಾ?
ಏನು ಹಚ್ಚಲ್ಲ,
ಆಯಿಂಟ್ಮೆಂಟ್ ಏನಾದ್ರು
ಮಾತ್ರ ಹಚ್ತಾ ಇದ್ದೆ.
ಅದು ಬಿಟ್ಟು ಬೇರೆ ಏನು ಹಚ್ಚಿರಲಿಲ್ಲ ಅಲ್ವಾ? ನಾವು ಕೊಟ್ಟಿರೋ ಮೆಡಿಸಿನ್ ಕರೆಕ್ಟಾಗಿ ತಗೊಂಡಿದ್ರಿ ಅಲ್ವಾ?
ತಗೊಂಡಿದ್ದೀವಿ.
ಓಕೆ, ಈಗ ಸಂತೃಪ್ತಿ ಇದೆಯಾ ನಿಮಗೆ ಹೋಮಿಯೋಪತಿ ಔಷಧಿ ತಗೊಂಡ್ಮೇಲೆ?
ಸಮಾಧಾನವಾಗಿದ್ದೀನಿ.
ಓಕೆ,
ಎಲ್ಲ ಗುಣವಾಗಿದೆ. ಅಂದರೆ ಹೆಚ್ಚು ನಾವೇ ಇಲ್ಲ, ಅವಾಗೆಲ್ಲ ಫುಲ್ ನಾವೇ ಇರ್ತಿತ್ತು. ಇವಾಗ ನಾವೇ ಇಲ್ಲ, ಸ್ವಲ್ಪ ಆಗಿ ಕಮ್ಮಿಯಾಗಿ ನಾನು ಚೆನ್ನಾಗಿದ್ದೀನಿ.
ಓಕೆ. As a patient says that she was suffering with psoriatic lesions from 35 years. She has taken a lot of treatments, and where she was not getting any kind of result. After she came here, once she started with the homeopathic medicines, she's feeling much better now. Just after 6 months, she's feeling normalcy. So this is the potential of SIMILIMUM. When we take the case correctly, convert the rubrics with the right approach, what can be given in the right way has to be given. So the result follows. This is the potential of SIMILIMUM. Yes. Let's move on to the third case. As you see in this, any diagnosis, any differential diagnosis, please chat it in the chat box. Anything, no problem. What you can see in this picture, just hint of the picture. Urticaria, good. Dr. Anita Soman said urticaria, good prediction. Anything else? Any other thing? This is a case of angioedema. Urticaria, when it comes to mucous membranes, to around the eyes, in the lips, it is called as angioneurotic edema or angioedema. A young boy, aged about 6 years, was presented with the skin eruptions over the body since 2 days. Itching was the presenting complaint. The eruptions were red in color, which used to aggravate evening after. It used to get aggravated in the midnight with itching. The patient used to get restless due to itching in the midnight. This was the picture. Can you see? This is on the trunk. There is a rash with edema. See another picture there. You can see what it is called as wheals. It is called as wheals. It's an angioneurotic edema. Definitely there is another few more pictures which shows the face of the patient. For the privacy reason, I have not shown in this slides. There is a swelling around the eyes and the lips also. Some part of the genitalia also. In one day, a patient has seen that. So this is a case of angioneurotic edema. So now, by seeing the eruptions, the prescription was straight away Rustox, 202 doses were given. Is a frontline remedy, what we can think of. After Rustox 200, there was no much improvement. The change of potency was made. Then also, there was no further improvement. So now, what can be done? The young boy is suffering. The parents are anxious about this condition. Can homeopathy help in this angioneurotic edema cases? Or shall we send it to dermatologist? Edema with urticaria. Yes, good. Anything? See. After that, tuberculinum bovinum 0/2 LM potency was given in that night. No aggravation was seen. By the morning, the boy was all right. There was no eruptions in the daytime. Then again, in the evening by 8:30 p.m., the eruptions started to appear. After that, EPIS 0/1 was given. After seeing the edema and all, EPIS mellifica 0/1 was given, but there was no change. EPIS 0/1 was repeated again. Only intensity was reduced a bit, but again the eruption started to appear. So, what can be given now? The boy starts to think, what is happening with me? What can be done now? Any inputs? Sure, we can cure, right? I would like the confidence from Dr. Anita Suman. Good. What can be done now? The boy started to thinking. Let's see. Rubrics. It is a case of angioneurotic edema. Skin itching midnight after. According to the Boning question, the time modality rates higher. So angioneurotic edema, skin itching midnight after. Can be taken? These are the only things we are getting in this case. It's an acute case. See what does the repertory shows. Angioneurotic edema, skin itching midnight after. The boy, the eruptions used to start with evening itself, only mild things, but it used to get aggravated in the midnight. The boy used to become restless. So what is the outstanding remedy here? What is this? Arsenicum album. So I have given him Arsal, LM potency 0/2, only single dose with water. Just 4 hours later, in the morning, boy got relieved. Till now, there is no eruptions. I think 6 months back, I have treated. What does it happen again in the counterpart? That if they give levocetirizine something, it has to be repeated. It has to be repeated. This is the picture. The boy is happy. The parents are happy. This is the potential of SIMILIMUM, right? SIMILIMUM. We have to take the case properly, convert it into rubrics, repertorize it, prescribe properly in the right potency. Just the cure follows. Potential of SIMILIMUM. Thank you one and all for the patient listening for today's session. Yes, I would like to take some queries. There is anything? Definitely. Yes, you can unmute it.
Thank you, Dr. Gurukiran. It's really, once again, you show that the beauty of homeopathy through your case presentations, and your presentations really excels everyone to goes in such ways. The beauty of homeopathy, the scientificity of homeopathy, everything was there in your presentation. And looking at the case itself, nobody could believe that the first case can be cured with such a medicine called opium, because that was the beauty of your case taking, because you got the remedy. What the patient was telling was wrong, but he really is always says the lies, and he tried to hide everything from you. That's why he wants to show you that I am a good person. That's why he is not just telling that I am taking this much of alcohol every day, but his brother really wants to save him. And that's why he told that Dr. He's talking is absolutely nonsense. So that really put you to choose the right remedy, and that really works here. Anyway, congratulations for such a wonderful session in this evening. And it's the time for discussion. Already Dr. Hariharan sir is there, the first one to talk to you. Yes, sir, you can go ahead. Hariharan sir.
Okay, Dr. Gurukiran.
Sir, how are you, sir?
Okay, I am okay. I am okay. A long interval I am seeing you.
Yes,
Very
sir,
good.
sir.
Very good. Very nice to see. Very nice to see. Okay. Very good case taking. Very good result. Everything is okay. Congratulations. Come
Thank you.
again, doctor. Okay.
Thank you. Thank you.
Yes, Dr. Rampresh sir.
Thank you, Dr. Dinesh ji, and pranam, Dr. Hariharan sir. Congratulations, Dr. Gurukiran.
Thank you, sir.
Very nice presentation, excellent session. This is beauty of homeopathy. Selection of remedy according to law of philosophy, potential of similum. Main cause of disease, emotional. Emotional,
Thank you,
grief,
sir.
anger. Very, very thanks, Dr. Guru Kiran ji. Nice presentation. According to role of miasmatic and psoriasis case, suppression of external and emotional anger suppression, grief suppression,
Yes.
many suppression after body psoriasis case.
Yes, sir.
It is very difficult treatment and long treatment. I am very happy potential and SIMILIMUM medicine. Very, very thanks, Dr. Guru Kiran.
Thank you, sir. Thank you. Thank you for your words.
Thank you.
So now I invite Dr. Bob Lim to say a few words as well as vote of thanks to the session. Dr. Sreshta, you want to speak? Dr. Sreshta, please open your video. Yes, you can unmute and speak, Dr. Sreshta. You are making some comments here and there. Okay.
Sir, actually, I'm not a doctor right now. I will join BHMS soon. I just completed my 12th right now.
Okay.
Acha,
No
okay.
problem. But you can say what is your experience with the homeopathy?
Sir, I was really interested in homeopathy, so that
You
is
are
why I joined the session.
joining to BHMS?
Yes, sir, very much.
Congrats for such a wonderful decision. We will be there to support you always, and you can join every day in our presentation. There, we are regularly doing the sessions, so please join every day from 8:30 to 9:30. Thank you, Doctor.
Sir, can you tell me how can I join?
Okay.
Today I saw the status of someone, so that is why I joined.
You can join the same link every day. The same link you use. Like if you want to join our group itself, we will allow you to join. You can send your WhatsApp number to any of us, so that we will add you to in that also.
Okay, sir. Thank you so much.
Okay, now it's the time to up to Dr. Bob Lim to speak.
Thank you. Thank you very much, Dr. Danesh. It has been a pleasure and an honor to be able to speak a few words for Dr. Guru Kiran. And your title today, The Potential of SIMILIMUM, surprised me a lot because we have a lot of good cases that you have shared with us. And you did it very well with the totality of symptoms. They cover up very well. And you have good results after that. And it is very, very good. And also when Dr. Ram was saying, I agree with him, also we can cover all these chronic cases with all these psoriasis, what is they have been telling. Then we hope that you will share more cases with us about this type of case taking is very, very beneficial tonight. And on behalf of the IFPH, I would like to express our sincere thanks to you for sharing this webinar tonight, the 1453rd daily webinar of the IFPH. And once again, thank you very much that we hope you will come back again and share with us more. Okay. And good night and good morning, everybody. Thank you very much. Over to you, Dr. Danesh.
Thank you, Dr. Bob Lim. Dr. Gurukiran, you want to
Yes,
say?
sir.
Thank you. Thank you.
Sir?
You want to say anything more?
That's what, sir. This is a platform where I think this is my 21st appearance today in this platform after I started giving the sessions here. So I'd like to take this opportunity to say thanks for the IFPH platform, which has given my stage to present my cases and to portray all my clinical conditions here and to know. Just I would like to thank once again for this wonderful opportunity given to me from your side, sir. Thank you. Thank you very much, one and all.
Thank you.
Thank you. Thank you.
Frankly speaking, frankly, the International Forum for Promoting Homeopathy is much happier than what you are. That is because we got such a wonderful person and to present such cases that to at an younger age you are doing such so much of beauty in the presentation. Thank you all for joining this session, and thank you, Dr. Gurukiran, once again. Hope that all of you will be here with us tomorrow also. And today, tomorrow we will have a session from Dr. Prashant Noel. He is the Associate Professor, Department of Organon of Medicine, LHIRC, Gujarat. And we'll be talking about Samuel Hahnemann, Story We Know More, Men We Know Less About. That is the second part of the same will be coming on tomorrow at the same time. Thank you all once again. Good night. It is over to Dr. Mariama John to moderate the Malayalam session.